Hello and welcome to the Neurologic podcast, coming to you from the UT Dallas Center for Vital Longevity, which is dedicated to pursuing research that leads to cognitive health for life. Our goal is to educate you on the latest matters relating to cognition and the brain, and with each episode we will be interviewing leading scientists and sharing their insights and suggestions to promote cognitive health throughout the lifespan. My name is Amber Kidwai.
And my name is Sarah Munir.
And this is Neurologic.
Today we're excited to be talking about something we have not yet discussed on the podcast, the relationship between brain health and heart health.
And we also get some input from Dr. Binu Thomas, who's an assistant professor at UT Southwestern Medical Center, who focuses on cerebrovascular health and neuroimaging. His research focuses on the relationship between physiology and brain health, aging, and dementia.
The brain is an organ, and like every organ, it depends on continuous blood flow. Considering that the brain is pretty small and only makes up about 2% of our body weight, it is so metabolically demanding. It consumes approximately 20% of our body's energy. And so maintaining well-regulated continuous blood flow is so important for brain health.
This is a really interesting episode because many of us think about our physical health, but many of us are unaware about how much that actually impacts our brain health. So we hope you enjoy this conversation.
I'm so excited to be talking about this topic today. I think it's such a fascinating conversation.
It is. The heart and the brain, they're so highly interconnected. You know, people think of them as separate systems.
Right.
Physically separate systems, but even physically they're so highly interconnected, and we really need to be aware of that.
Yes, yeah. There are so many blood vessels in the brain, actually. And for blood to get to the brain, it's supplied by two major arteries. There's the internal carotid artery, which supplies the front portion of the brain. And there's also the vertebral artery, which supplies the back portion of the brain. And these branch into smaller vessels that eventually become capillaries. And those are what supply the neurons, the brain cells, with the oxygen and nutrients that they need.
All the energy.
Right, exactly. And so we want these pathways to remain as smooth and uninterrupted as possible in order for that blood flow to get to the brain.
So the heart pumps blood in pulses, and with each heartbeat, a pressure wave travels through the arteries because it's a very powerful mechanical pump, right? So in young, healthy individuals, the larger arteries like the aorta, they're elastic, and that's really important because it kind of acts like a buffer.
Right.
So as the pulse wave comes from the heart and that blood is like pulsing out, the artery will stretch and recoil with each pulse. And that stretchiness is really important because it buffers those pressure waves. And so that by the time the blood reaches the brain and goes into those small vessels that you were talking about, the flow is much more stable and less pulsatile.
Yeah, that makes sense. And so that's what's happening in a young, healthy brain. But also as people get older, that elasticity with the arteries is no longer as good as with young adults. And so what happens is that, so the blood vessels are lined with this fiber called elastin. And so that's what gives them that elastic property. But as people get older, that elastin starts to break down. And often what happens is there are more of these collagen fibers, and they're just less stretchy, right? And so what happens is something called arterial stiffness occurs with age. And when arteries stiffen, they don't dampen that pulse wave that's coming out of the heart as well anymore. And so you can imagine that the blood is now coming at such a higher velocity and pressure into the brain. And it will eventually damage those delicate microvasculatures in the brain. And often with age, we see a higher risk of these vascular conditions like stroke and something called small vessel disease as well, right?
Yeah, so we talked to Dr. Thomas about this.
Yes.
So let's see what he has to say.
Yes.
As we get older, the blood vessels get stiffer. And, with added complications of high blood pressure and diabetes and so on, these are all pretty common with aging, that comes with aging. The blood actually flows more, has a higher velocity as it enters the brain, which actually ends up damaging these small capillaries and the small blood vessels in the brain. And that's what actually is bad for the brain.
Yeah, so that reduction in elasticity or that stiffening of the arteries really actually affects the brain, which is not something people think about.
Exactly.
Right? That pressure wave that's coming from the heart is now not being dampened down.
Yes.
And so as we get older, the overall amount of blood flow in the brain, which we call cerebral blood flow, decreases. Even though your blood pressure actually increases as you get older, which I know kind of sounds... doesn't make much sense when you think one is increasing and one is decreasing, but a good analogy is if you imagine water flowing through a stiff, narrowed garden hose, right? When you push the water through, it spurts strongly, which is the high pulsatility, and that can cause damage. But in between each push, there's barely anything flowing, so the overall flow is lower. So even though the spurts are stronger, the total amount of water that's being delivered is much lower.
Okay, great. Yeah, that's a great analogy, actually. And so we're talking about blood flow that's being controlled outside of the brain, right?
Yeah.
But blood flow is also controlled inside of the brain. So there are these tiny contractile cells that wrap around the brain's blood vessels. And so these are responsible for adjusting the blood flow of these brain vessels depending on how active nearby neurons are. So they can contract, expand the brain vessels.
So they're just kind of gripping onto the vessels
Exactly,
on the
yeah.
outside of the vessel, right? And they can kind of tighten and
Right,
loosen,
yeah, they can tighten or loosen it as the blood is flowing. And so what happens is normally the brain can control the blood supply to match the energy demands. But as people get older, in aging and even in conditions like dementia, these contractile cells around these blood vessels start to contract abnormally, often too tightly.
Yeah.
And so that reduces that blood flow happening inside of the brain.
So that's where you've got the high pressure blood now coming into the brain because
Yes.
the arteries have stiffened, and then once it's there, it's also being affected by these cells that are not contracting properly.
Right, yeah,
And-
so they're two separate mechanisms.
yeah,
that-
so you've got that reduction in the blood flow, which is causing those spurts and things
Yes.
that we talked about. Okay.
Exactly, yeah.
So basically, as we age, like you said, our cerebral blood flow decreases because of the vessels in the brain. They're not, they're not contracting properly, and they're sometimes narrowing. And so in conditions like dementia, Alzheimer's disease, we see even more of this decrease, right? And so as we discussed, the brain depends heavily on a constant supply of oxygen and glucose. That's kind of its energy supply for the engine of the brain.
Yeah.
So even small changes in blood flow can be associated with declines in cognition as we age.
Exactly, yeah. So, I mean, we mentioned in the beginning, the brain is just so metabolically demanding.
Yeah.
So it's so crucial that it's getting that glucose,
Yeah.
which is kind of like that energy powerhouse
Yeah.
of the cells. So we've talked about like the decreased blood flow, right? That's happening when people are getting older. But we should also mention that the function of something called the blood-brain barrier is
Yeah.
also affected with aging.
Yeah.
And so obviously we see that more in conditions like Alzheimer's disease and things
Yeah.
like vascular dementia. But even in individuals we would consider healthy agers, we see that this blood-brain barrier is just not functioning as well anymore.
Yeah, and just to clarify, vascular dementia is where the narrowing of the blood vessels in the brain or the kind of degeneration, I guess, of the blood
Right.
vessels in the brain is directly leading to kind of a decline
Dementia,
in
yeah.
cognitive function, right?
Yes,
Dementia,
exactly.
yeah.
So that's more vascular dementia is a bit different than Alzheimer's
Yeah.
disease. Alzheimer's disease typically has these pathologies we call amyloid and tau.
Yeah, the plaques.
The
that are in
plaques,
brain,
exactly.
yeah.
So they're these sticky plaques that kill brain cells
Yeah.
eventually. With vascular dementia, the symptoms of cognitive decline are usually being led more by these vascular changes
Yeah.
we're talking about. And so coming back to that blood-brain barrier, it's a specialized layer of cells, right?
Yeah.
And so it's what they do is that they're connected into these very tight junctions. And so that they kind of act like a filter, and they modulate what molecules are able to make it across that barrier to the brain.
Yeah.
And we know the brain is just so sensitive to chemicals and certain molecules, and so this filter is really helping to protect these dangerous chemicals from getting past and into the brain organ.
Yeah, so it's literally like a barrier, right?
Exactly.
It helps prevent any harmful molecules or toxins, any inflammatory proteins
Yes.
that are in the blood from getting into the brain.
Yes. And so when this blood-brain barrier the function starts to decrease with age and conditions like Alzheimer's disease, now potentially harmful chemicals are now more easily being able
Yeah.
to penetrate inside of the brain.
Yeah.
And we know, like with conditions like Alzheimer's disease, inflammation is such a big problem, right? And so you can imagine that these larger inflammatory molecules are making their way into the brain more easily.
Yeah, so the blood-brain barrier basically can become leaky.
Exactly. Yes,
And
that's
things
a good
can
way
leak
to put
into
it.
the brain. Yeah.
Yeah.
Okay. So when we were talking about vascular disease just now, there are actually two major types of vascular disease in the brain, right, which affect the blood vessels. So there's a large vessel disease, which, as it says, kind of affects the larger vessels.
Right.
And this can lead to major strokes, right? So this is when you'd have something like a blockage in a large vessel, or if the large vessel ruptures. So an ischemic stroke is when there's a blockage, or a hemorrhagic stroke is when there's a rupture.
Yes.
And then there's small vessel diseases, which, as it's, the name kind of suggests, it affects those smaller vessels in the brain.
Right.
And that tends to be much more subtle and accumulates over time. And so you get kind of these tiny microbleeds, white matter damage, these tiny infarcts, which can go unnoticed for years.
Yeah.
And just kind of accumulates.
Exactly, yeah. So these small vessel disease, we typically actually are able to visualize these on structural, MRI scans. And they do, like you said, appear even in who we would consider as cognitively healthy older adults. And the problem with the small vessel disease, it's not just a huge major event like when we're talking about stroke.
So you're not going to get that giant stroke where you're going to know something's wrong. It's so tiny that you might not even be aware.
Yes,
right?
and the problem with that is they can accumulate. So these small vessel disease damages can accumulate over decades.
Yeah.
And often people don't realize they have these until they start to have symptoms of cognitive issues.
Like there's been so much accumulation and damage that now you're having symptoms. Yeah.
Yes. So often, like on MRI, we might visualize these very bright white spots on the scan. Those are indicators of something called white matter hyperintensities, which are usually because of damage to myelin. So that fatty substance that wraps around the axons of the brain cells. And it allows communication between brain cells to be faster.
Yeah.
So when those start to degenerate, we might see something like these bright spots appear on an MRI scan. And again, this is something pretty common with healthy aging. We see it more so with individuals who go on to develop dementia, but they just accrue over years.
Yeah, but aside from aging, it's also very common in people with hypertension and diabetes.
Yes.
Yes. That's a major kind of indicator of that. Yeah.
Yeah.
So one of the most important questions is, how early does this process begin? So we actually talked to Dr. Thomas about this. So let's see what he had to say.
It starts early, earlier than we typically think of. So we typically think of middle age is when things get worse, but you know what? It's not. It's much earlier. So I think in early young adulthood itself, especially people who are prone to diabetes and high blood pressure at a younger age, I think that's when the changes begin. But you see changes like, I think 10 decades or a decade later on cognitive function.
Yeah, so there has actually been a lot of interesting research done on midlife vascular risk factors. So I'll kind of going back to what Dr. Thomas said, that a lot of these damages to the brain can appear decades before we actually see the symptoms, the cognitive symptoms. And a lot of times they appear in midlife. And things like hypertension and obesity can contribute to those risk factors and is associated with cognitive decline decades later.
Yeah.
And so there was a 2024 report of the Lancet Commission on Dementia. And they estimated that about 45% of dementia cases could be potentially delayed or reduced by addressing 14 potentially modifiable risk factors.
So kind of lifestyle factors that you can change.
Yes.
Yeah.
So these are stuff that we have some control over, right? And they do mention a couple of midlife modifiable factors. So a lot of these are tied to vascular health. So the things we're talking about today, things like obesity, hypertension, diabetes, these all impact vascular health. Smoking is a big one as well. And so they do talk about these potentially modifiable, that it can appear in midlife and affect cognition years down the road.
But it is important to know that these are just risk factors.
Right,
so there's no evidence that they cause dementia, right? There's not a causal relationship. And this report also doesn't address very early life factors like the kind of nutrition you might have had as a child, or the kind of environment you grew up in.
Right.
And also these days, people are getting vascular issues at very young ages. And as Dr. Thomas mentioned, he was talking about how even earlier now you're seeing hypertension and diabetes. And so these changes can start even earlier in the brain. And so that would also go on to affect your later cognitive health.
Yes.
So we would have to do kind of randomized controlled trials, which are not always possible in these cases.
Yeah, there's ethical issues there, right?
Yeah,
because if somebody has like hypertension and you have one group one group is being treated for hypertension, the other one isn't.
Yeah.
That's the only way to look at causal factors, right? And we can't do that.
Yeah, and so because of that, that's kind of the best way to look at interventions and dementia prevention. But yeah, there are ethical issues with that.
Yeah. And so kind of coming back to, we were talking about MRI and how we're able to visualize some of the damage that we can see associated with things like small vessel disease. But a lot of times these structural scans, they're showing damage that has already happened.
Yeah.
So they're like these non-reversible damages.
Yeah, it's like the scar tissue after the after the injury. So,
right, exactly. And we're not able to reverse those most of the time. And so researchers are increasingly starting to ask the question is, can we measure vascular function before these permanent structural damages are appearing on the brain?
So you can have more of a preventative approach or maybe a limiting approach, at least to limit the damage.
Right, yeah. So that's a big question in research right now.
Yeah. So Dr. Binu Thomas uses something called cerebrovascular reactivity or CVR to measure vascular function. So you can kind of think of it as a stress test for the brain. They expose the brain to carbon dioxide while they're in the scanner, and they look at the reactivity of the blood vessels, because healthy blood vessels should kind of very quickly dilate
with this carbon dioxide
and push out the carbon dioxide, but unhealthy ones will not be able to as much. And so you can literally see, because in MRI scans, in functional MRI scans, we actually are looking at the oxygenation, the blood oxygenation level, exactly what we measure.
Right.
It should, because the more active neurons are, the more
oxygen they're requiring.
Yeah.
Yes.
And so the more blood they require. And so, this kind of is a stress test in the sense that when you give CO2 to a person and they're not clearing it out as quickly, they're obviously not reacting. Their vascular system in the brain isn't as reactive as it should be, right?
Right.
So here's how Dr. Thomas explained it.
So vascular reactivity is the ability of the blood vessels to vasodilate or expand as it receives any agent such as carbon dioxide. Carbon dioxide is a good vasodilative agent, meaning when someone inhales carbon dioxide, the blood vessels will dilate and bring in more blood to the brain. And so it's this the capacity of blood vessels to expand and or the elasticity of the blood vessels, which is what we are looking at. And
And how is that an indicator of brain health?
Correct. So when you're young, I think your blood vessels are pretty elastic, and it brings in the required blood, meaning when you're doing some sort of a challenge, like a math problem or a memory problem or something, the amount of blood that's needed for that challenge is arriving correctly to the particular region that's doing the problem. But as you age, these change. It's well known that as you age, your vascular reactivity diminishes or decreases, but it also worsens with conditions like stroke or high blood pressure and diabetes. So there's a lot of research that's ongoing, but in general, as we age, vascular reactivity or the elastic capacity of the blood vessels decreases.
So as we just heard from Dr. Thomas, measuring this CVR can potentially help determine future risk of cerebrovascular disease.
Yeah.
And so CVR, it can decrease with age, right? So kind of like what we talked about with this carbon dioxide being inhaled, these blood vessels are not expanding as well as they should be. And in more severe cases like dementia, we see an even bigger risk to, or even bigger decrease of this CVR.
Yeah.
And CVR is correlated with cognitive measures. One thing I do want to mention is that this is not yet used in clinical practices, so it's still mainly confined to research laboratories. But Dr. Thomas did mention that this is something that they're hoping in the future they can integrate into clinical practices, which I think will be so important in terms of being able to modify or potentially address these issues before the damage is happening.
Absolutely. And another key concept is neurovascular coupling, which is the coupling of blood vessels and neurons. So as we mentioned before, when neurons become active, they require more energy, right? More oxygen
more
and
nutrients,
more glucose. And so healthy vessels respond by increasing that blood flow so they can get the energy they need to be active in that moment, when you're doing a particular type of mental activity. And it's actually these changes in blood flow that are measured in fMRI to understand which parts of the brain are active at a certain time.
So with fMRI, we're like indirectly measuring neuron activity.
Yeah, we're kind of assuming that when we make you do a certain activity in the scanner, like a memory test, that the parts of the brain we see active are involved in memory. But it's a bit of a big assumption.
It's a big assumption, right? Because we're assuming that this brain region that's being active is now needing so much oxygen. And that's kind of directly what we're measuring there.
Yeah. So coming back to CVR, Dr. Thomas mentioned that a region that suffers from lower vascular reactivity will appear a different shade to the rest of the brain in fMRI, because you can see where that blood flow is.
So will it be like darker? Typically darker,
depending on the contrast that's used, but usually darker. So you can see regions involved in executive function, memory, and language actually being affected by lower CVR. So the kind of behavioral symptoms you might see is difficulty in decision making, and obviously memory tasks, or coming up with words for language. So CVR definitely can kind of be directly related to behavioral symptoms.
Right. Yeah. And I think, because it's such an early symptom of potential issues of, vascular function, I think that typically with CVR, kind of what we talked about with like small vessel disease, it happens like decades before you actually get the symptoms of cognitive or memory impairments. But it's exciting to see that measures of CVR could potentially become integrated into clinical practices. So before it starts affecting cognition and memory, what can we do?
Exactly, yeah. Because by the time you get those symptoms, it's usually
too late. Exactly.
Yeah. So talking about healthy vessels, let's discuss some of the things we can do to keep those blood vessels healthy. So I think what we kind of learned from this discussion today is firstly, heart health is brain health, right? So
what's good for the heart is good for the brain.
Exactly. So monitoring and managing your blood pressure is critical. Untreated hypertension over years can significantly increase the risk of brain injury, vascular brain injury. And studies have shown that people who have high blood pressure actually have a smaller frontal lobes. The volume of their frontal lobes is smaller. So there's a very direct impact of vascular health on the brain. And that's something that Dr. Thomas mentioned as well. Do
we assume that because their frontal lobe is smaller, and we know that the frontal lobe is involved with like executive control, it allows us to make better decisions, control impulses. So does that mean they're having issues with those behavioral problems? Can we make that assumption?
I don't know if we can make that assumption. I'd have to look into the research, but I think in terms of the volume of those areas, they're
decreasing, right?
But then we do know that cerebrovascular reactivity, CVR, is related to problems with executive function. So I guess that would kind of lead you to think that it is the lower volume is also correlated with the function of that area.
Yeah, and then also another important thing to mention is regular exercise. So I think we all are pretty aware of how impactful exercise is on physical health. And also I think people are realizing just how much it helps with brain health as well. And so I think that really kind of demonstrates that interconnection between heart health and brain health. So the benefits you're getting from exercise for the heart does translate to also brain health.
I mean, you can actually reverse damage from high blood pressure.
Interesting.
Just by doing things like walking or running, some kind of cardio exercise most days of the week. And, exercise is kind of prescribed for high blood pressure, diabetes, high cholesterol. And so like we said, just as you can reverse, people are able to kind of reduce their blood pressure and reverse some of that damage, you can do the same thing for your cognitive function
Interesting.
too. And then obviously weights is also
that's like a huge one as well.
So Dr. Thomas actually talked to us about a study that he did in patients with mild cognitive impairment, or MCI. So this is a diagnosis which is a precursor to dementia. And so let's hear what we had to say. So how much of cognitive decline is preventable then if you optimize your cardiovascular health?
Not all of it, but I think up to a certain limit. So for sure, if you exercise on a regular basis, I think it improves cognition. We've actually done a study in mild cognitive impairment patients. These are people at the early stage of Alzheimer's disease, and we've actually put them to exercise for almost 1 year. We've seen improvements in their cardiorespiratory function. We've also seen improvement in blood flow to the brain, which actually leads to improvement in cognitive function, meaning their memory actually started improving. These were patients with amnestic MCI, that is, they forget things more commonly, and their memory function actually improved after exercise.
So, like, what kind of exercise were they doing for a year?
That's a great question. Yeah. So they were doing some aerobic exercises. Yeah. And it was pretty well structured. That is, we begin at a smaller intensity, roughly 20 to 30 minutes a day. Eventually, the intensity is increased as well as the duration. Mm-hmm. After about 25 weeks, the intensity and duration is increased. So we go up to 40 minutes, and we ask them to raise their heart rate even more, mm-hmm. And compared to the 25 weeks prior. Mm-hmm. And then eventually, the last half, we actually add almost an hour of exercise, of aerobic exercise with a higher intensity.
Per day?
Per day.
Wow.
Yeah, and that seems to actually benefit the patients.
So if at the end of the year, if they stopped, did they start declining again, or was it?
No, that's a great question. Yeah, so we actually don't like them to stop. So we haven't really pushed that far. Yeah. I mean, it'll be an interesting study to see if they do stop, and then does brain function deteriorate further.
So in these MCI patients, as he mentioned, they had 1 year of exercise that they were told to do as part of the experiment, and they found that they actually had an improvement in their blood flow to the brain. Wow. And their memory function was improved too. Yeah. So it means that exercise can really have profound effects.
Yeah, for sure. And I think that study really demonstrates just how effective it can be.
Yeah.
Another hot topic these days is GLP-1s. Yeah. So we know that many people are now using this for weight loss, mm-hmm. and it's also prescribed for individuals with diabetes. Mm-hmm. So we know that excess body fat, as we're talking about, diabetes and blood pressure, high blood pressure, can all affect brain health.
Yeah.
So it's interesting to see that these GLP-1s that are addressing these risk factors can potentially also be impacting brain health.
Yeah. I mean, Dr. Thomas is actually currently working on a study to look at this. So far, they've only got a small sample, but in that small sample of people, he found that GLP-1s actually improved cognitive function.
Wow.
And so they were comparing people who had taken GLP-1s versus taken other more traditional diabetes medications. And they also found in other studies that patients with diabetes who take GLP-1s versus the more traditional diabetes medicines also reported a lower incidence of Alzheimer's disease. So it definitely has an effect on cognitive function.
So it seems that it's not just the weight loss that is improving that brain health.
Yeah, I mean, the weight loss is impacts your vascular health, but there is also something else going on.
Okay, yeah. So GLP-1s in itself seem to have some kind of benefit on brain health.
Yeah, they directly impact the blood hemoglobin, they lower glycemia, they lower the insulin resistance, and all those factors also then impact the brain in a positive way.
Right, yeah. It's interesting to see whether GLP-1s in the future will be prescribed for brain health. Yeah, just for that instead of weight loss or diabetes.
Yeah.
So stay tuned for that. And then so when we think of cognitive decline or dementia, we usually think of neurodegeneration, right? And when we're talking about neurodegeneration, we're talking about like the shrinkage of the brain.
Yeah,
so
the brain's dying.
The neuron's dying. The brain itself starts to decrease in volume and thickness. Mm-hmm. But with our conversation today, it's vascular health and vascular function is also playing a big role. It's not just the brain cells are dying.
Yeah.
It's also how well is that blood supply getting to the brain.
Yeah, the energy supply, right?
Yes.
Are they getting the energy they need to survive? And
yes.
It's kind of a big question to think about. Is the energy supply causing this, or is it that there's less neurons there and they don't need as much energy, which is probably a bit of both, right?
Yeah. It probably is a bit of both.
Yeah.
Because we know the vessels' health themselves start to
also
decline.
declining. Yeah, exactly.
Right. And as we talked about, like the blood-brain barrier function is starting to decrease.
Yeah.
Which is separate from
so things
the brain
are leaking
cells
into
dying.
the brain. Yeah.
Yes.
So these different risk factors, they all impact the brain differently, but they often coexist, right? Mm-hmm. People who have hypertension also tend to typically have diabetes or obesity. Yeah. So the more risk factors you have, the bigger the risk for vascular issues. So there is an additive effect. So, it's worse to have more risk factors. It's not like it doesn't make a difference.
Yeah.
And now we know that brain aging starts in midlife. So taking action earlier is always better.
Right.
Doing things like exercising, eating right, managing your stress, sleeping well as well, because during sleep is when we flush toxins from our brain.
Yes.
So that's all really important too. So all of these things, just generally having a healthy lifestyle really impacts your cognition.
Right. Yeah.
And so
And so also coming back to that 2024 report of the Lancet on dementia that we talked about, and when they were discussing these 14 potentially modifiable factors that can potentially decrease cognitive decline, we did mention that those are not causative. So we can't say that regular exercise will, guarantee that you don't get Alzheimer's or something similar, or that hypertension causes dementia or Alzheimer's. But, taking general steps towards better health is going to potentially impact and improve so many functions across your body. And I think those are the right steps to take. Whatever you can control, try to do your best to integrate those, even if we're not sure about their causative.
Even if they are just, you might still get Alzheimer's disease, but maybe it will take longer to
and that's a big one too, right? So if we can even delay the onset of Alzheimer's, that's still a big win.
Exactly, So the main message, I guess, is that protecting your blood vessels will protect your cognition, right?
Right, and I think there's kind of what we talked about. There's growing interest in integrating measures of vascular health into research and clinical practice as well. Because as we talked about, traditional MRI, that can only visualize damage that's already happened. So these techniques that are being developed, like similar to what Dr. Thomas talked about, the CVR methods, it will allow us to much better measure these vascular functions that can allow earlier detection and allow us to step in sooner, and interventions are more likely to be effective if we can get there before the damage happens.
It's really exciting where this field is going, because these interventions could prevent or alter the course of dementia. So if there's one message from today's episode, it's that what's good for the heart is good for the brain. Thank you for listening to Neurologic, the CVL podcast. If you like what you're hearing, please follow and share with others.
This podcast wouldn't be possible without the support of our team and the incredible work that goes on behind the scenes. We'd like to give special thanks to Patricia Moran, our marketing and operations producer, and Pan Gu, our audio-video producer and editor.
To learn more about the Center for Vital Longevity, just look up cvl.utdallas.edu, and here you'll find information about our research, as well as information on how to volunteer to participate in our studies and how to donate to support innovative research to understand, protect, and enhance the vitality of the mind across the lifespan.
Join us next time as we continue to explore the latest research and strategies for keeping our brains healthy throughout our lives.